This technique is hip PNF agonist reversal. So this is an eccentric contraction for the patient. So this is really challenging, is a great step up after doing repeated contractions or slow reversals, and then maybe even after a hold at end range as well. So the patient's gonna actively contract to bring herself up into hip flexion, abduction, internal rotation. I'm gonna have her hold it there, and then I'm gonna say, let me win. So it's really important for this one that the patient understand they are to give a submaximal contraction, just enough so that I can overcome them and begin to push them back down to the table. So they're eccentrically contracting that hip because I'm pushing it back down to lengthen those hip flexors, but they're fighting against me. So if you try to do this and your patient goes right down to the table, then you need to ask them to push harder against you. Or if you try to do this and you just can't overcome them because they're too strong, you need to ask them to lighten up their contraction a little bit. So a reminder, all PNF needs to be smooth and coordinated motion. So if you're doing this and you're like, and you're kind of herky-jerky throughout it because you're not matching their strength against your strength really well, it's important to have a conversation with your patient about that and say, this isn't a competition, you're not trying to overcome me, we need to be working together to try to make this as smooth and coordinated as possible. Does that sound good, patient?
Yes.
Okay. Now this time Heather's going to demonstrate really good visual cues, which is going to help us also see how facilitating the core is possible through making sure that Heather's watching her foot essentially throughout this whole technique. So when Heather's foot is down here, this is what we're going to see Heather do. Okay, we're getting some core engagement there. Okay, all right, so we're going to do agonist reversals. I might have you hold it up here at the end range just a little bit. Okay, so toes up, foot up, bring your leg up, heel out towards me and hold it there. Okay, now let me win. So resist me, but let me win. Perfect, and push up, push up, push up, push up, and hold it, hold it. Now let me win, and push up. So I'm not resisting on the flexion. Hold, hold. This is where I'm resisting. Push, 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 and come up, and hold. Good, and let me win, let me win. One more, up. Okay, hold it. Now let me win, let me win, let me win. Good.